To understand just how big this ruling is, you have to understand just how big a footprint HCA has in Kansas City. Anchored by Research Medical Center on Meyer Boulevard, HCA has 9 hospitals in Missouri and Kansas that ring the metro. By some estimates, it commands 35 to 40% of the market. And HCA is a behemoth, the largest for-profit healthcare company in America. It showed a $360 million profit in its last quarterly report. Make everybody understand the significance of this opinion from the Jackson County Circuit Court.
It vindicates the interest of all those neighborhood people who became concerned when the deal was first announced.
Landon Rowland is the former chairman of the Kansas City Healthcare Commission and someone who was worried about HCA from the very beginning. Not only was it a for-profit company buying nonprofit hospitals, but it was the largest transfer of nonprofit assets to a for-profit company in the history of the country.
These hospitals were largely created by religious groups or religious authorities, some of them as late as in the late 19th century.
We had a great concern about Health Midwest, of course, first going out and then selling, and possibly selling to a for-profit hospital organization.
Bishop Mark Tolbert from Victorious Life Church was in those early talks with HCA. He too was worried about turning over charity hospitals to a for-profit corporation, but he believes HCA has held up its end of the deal.
I still feel that if HCA, because they have proven themselves to be good community partners, they've done a lot of things up and down Prospect. They're working with some community development organizations to try and improve those areas. Even on Truce, near where the old Baptist, they're talking about putting in senior citizen living, which is something that we need in the urban core.
To ease the way for this unprecedented hospital deal, HCA agreed to some things the community demanded. It funded 2 healthcare foundations, one in Missouri and one in Kansas, which make health-related grants. But it also agreed to 2 things central to the lawsuit: to spend $450 million to upgrade existing hospitals, and to provide $500 million in charity care. In a 140-page ruling, Jackson County Judge John Torrance said HCA failed on both accounts. In 2002, these Health Midwest hospitals, 8 in Missouri and 3 in Kansas, were starved for cash and in desperate need of repair and upgrading. HCA came to town and promised the community and regulators that it would fix them. But according to court documents, another plan from HCA began to emerge. First, HCA closed Baptist Lutheran Hospital. Then it closed Lee Summit Hospital, Medical Center of Independence, and Independence Regional Health Center. It then spent $343 million to build 2 new hospitals in fast-growing eastern Jackson County, Lee Summit Medical Center and Centerpoint Medical Center in Independence. And it seemed to me that HCA was looking to treat patients in parts of the metro where there's a pretty good chance they're insured.
Very hard to see how they could avoid moving the enterprise to where the dollars are.
In fact, this confidential HCA memo, entered as evidence at trial, said the same thing. The replacement facility, the memo says, is located to the east of the existing hospitals with a young, affluent demographic mix. Conservatively, the percentage of managed care business is expected to increase 43% by year 5. In short, fewer poor patients means more people with health insurance. We asked several times for HCA to appear on camera. It sent this statement instead. Obviously, we are disappointed in the court's ruling, and we intend to appeal. Rather than simply put money into the repair of old facilities, we built 2 new hospitals, spending hundreds of millions of dollars to ensure this community has high-quality care.